Welcome back, everybody. XPhys Guy here. Today we're going to be talking about the profession of exercise physiology. We've discussed personal training and we've discussed strength and conditioning in some other videos that we've done here, but we haven't talked at all about yet exercise physiology as it fits in the realm and world of exercise science. Exercise physiology, I think, is one of these sections that doesn't have as much I'll say maybe notoriety, for lack of a better word. In other words, a lot of individuals have heard about personal trainers or strength and conditioning coaches, but you don't really hear too much about exercise physiologists. And I think it's partially because it's a new field, a relatively new field. It's rapidly growing and changing. There are certifications that have changed. There are some job tasks that have changed. But basically, if someone was to say to me, Jonathan, how are you going to define an exercise physiologist? I would say they are allied health professionals. Yes, they're fitness and wellness professionals, but allied health as well. And they are responsible or tasked with, taking exercise training to the next level with patients. They will not only administer basic health and fitness screenings, including, blood pressure screenings, auscultation of things like your heart sounds, and, basic checkups like that. But they'll also administer other health and fitness tests, like maybe some submaximal exercise tests or some body strength tests or body endurance tests, and they'll interpret those results as well. Now, one of the biggest, or probably the biggest difference between, say, a strength coach / personal trainer and an exercise physiologist is that an exercise physiologist is really going to work with anyone from the range of, assumed healthy to those who have medically controlled either cardiovascular, pulmonary, metabolic diseases such as diabetes, or other diseases, musculoskeletal disorders. Now, we're not necessarily, as exercise physiologists, we're not treating these conditions, but what we're doing is we're using exercise and total, health and fitness, wellness, behavioral modification as well to help control and act as secondary prevention for a lot of these conditions. So that's really the biggest difference when you get to from personal training to, say, exercise physiology. And there are some other differences as well. One of the big ones is in education and certifications. To be able to call yourself an exercise physiologist, you have to have the certification. And I know I said I wouldn't name drop, but the biggest one, the most well-known one that is out there is through the American College of Sports Medicine. Their exam that used to be called the Health Fitness Specialist is now called the Exercise Physiologist. And they do have another step above that, the clinical exercise physiologist, which I will cover clinical exercise physiology, which is my main area of specialization. Now, I'll cover that in another video. But you must have the exercise physiologist certification. And through the ACSM, you have to have a 4-year degree for that before you can sit. And you have to have your CPR and your AET certification. So whereas with personal training certifications, you don't need as much schooling and as much preparation. It doesn't mean that personal training is any less important than exercise physiology. They're just different paths that you can take. If you want to become an exercise physiologist, generally you'll probably be working with somebody who isn't necessarily totally healthy and ready to go and boom, boom, boom. They may have some underlying issues, some medically controlled cardiovascular disease. And keep in mind, cardiovascular disease is an extremely broad term. I mean, that's anything from diagnosed hypertension, that's cardiovascular disease, all the way down to, say, peripheral arterial disease or congestive heart failure. Congestive heart failure is a little high risk. That's where clinical exercise physiologists will step in. But, let's say you're working with an individual who had myocardial infarction, heart attack 10 years ago, and they've been on medically controlled and they've been doing well. They are, they exercise regularly, but they want a little bit more help. That's when the exercise physiologist steps in, because it does take a little bit more knowledge and a little bit more specialized knowledge and education and training to work with these individuals to keep the exercise, and these are my two big words here, to keep the exercise safe and effective. So to answer the question, well, what's the difference between an exercise physiologist and a personal trainer? Generally, in practice, personal trainers are going to work with healthy populations, really, whereas exercise physiologists will work with those who maybe don't, who aren't 100% healthy, and an exercise physiologist can and will administer a much wider range of tests, be it from blood pressure to, again, auscultation or listening of the heart. We check ankles for swelling or anything like that. We can administer point of care capillary punctures if we had to for blood glucose in the diabetic population. So, and there's some other knowledge there, and they might administer different fitness or exercise tests than a personal trainer would. Doesn't mean they're any better. It just means they're different. It's like if you go to, your primary doctor, and one of them is a medical doctor, an MD, and the other one is a DO. It's not that they're any better or worse. They're just different. So I hope this was a good explanation of the difference between the two and what, as a student, you might be looking for, or as an employer, you might be looking for. As an employer, if you're a facility, so an exercise physiologist, let me back up. You may not see them as likely in your areas such as your LA Fitnesses or your any other wellness area like that. You may see them there, but you'll most likely see them in hospital settings, other clinical settings, corporate settings, maybe even settings for nursing homes, assisted livings, things like that. So you'll see them in different areas. More than likely, you won't work with an exercise physiologist if you're say at your everyday gym. Now they may decide to work there because an exercise physiologist can do the work of a personal trainer. Now, does that mean they have to? No. They could choose to go into that more allied health profession and clinical health, or they could stay in the training realm of the profession. So if you see, you go to your gym and to say, oh, well, I want to hook up with a personal trainer, and they might say, yeah, we have an exercise physiologist on staff now. But remember, if they are calling themselves an exercise physiologist, that means they have some certain schooling and certain certifications. So don't be afraid to ask, hey, which certification do you have? Because again, not all certifications are accredited. And that's why I do bring up ACSM a lot, because they are accredited. They are an accredited organization that has certification exams. But not all are. And you want to make sure you're professional, and you, if you're a student or a professional, you want to make sure your certification is accredited. It gives you that validity. It gives you that punch to say, yes, I am legit. I'm the one you're looking for. So, those are some of the nuances that, especially as a young student, if you're looking at, you don't want to just go and get any old certification. You want to get the ones that are accredited. You'll always be safe if you go through something, an organization such as the National Strength and Conditioning Association or the American Council of Exercise, ACE, or the ACSM. Those are the three big that I like to call them. And I believe ACE does have a certification that is similar to an exercise physiologist. I want to say they maybe call it their medical exercise specialty or something along those lines. Compare and contrast them. And because, there's some differences, but there's some similarities. But, I can tell you just from personal experience as both a professional and a student and somebody looking to hire, that typically I'll look to go for one of those big three. Do they have an ACSM or an NSCA or an ACE certification? And if they do, that just as an employer or say someone who's hiring, that makes it a lot easier for me. I say, oh, okay, I know what they went through to get the certifications that they had to get. So again, before I ramble too much, I hope this has been at least a good introduction to what exercise physiology is. Now, are there other areas you can go into? Yes, you can get a master's degree in exercise physiology and go on into research and work for say a laboratory for a sport and fitness laboratory. I'll use Gatorade just as an example. You go and you work in the labs with them and you stress test athletes and you push them and you see what the physiological changes are, what's their RER and their RPE and what's their VO2 max look like, and you develop different training and different protocols, and you're there as a researcher. So yeah, you can get master's degrees in exercise physiology. You can go on and get doctorates in exercise physiology and become researchers and professors. Or you can, do what we call practice, which is where you where you work with clients and with patients. So I'll leave it at that. Again, as always, if there's any questions or comments, put them down in the section below, and I'll try to put in some links in there as well for job descriptions and of what each one a personal trainer, exercise physiologist does. So stay safe. We'll see you again.